Hey guys, this is Dr. Hub. Today we look at the examples and this is going to be of the sphingolipidosis. So to begin with, these are the sphingolipidosis. These contribute to the LSDs. LSDs, here we are referring to the lipid storage disorders. So let's look at the flow chart. So looking at we start with the gangliosides. So these gangliosides, it contributes to the Tay-Sachs disease. So there is presence of the Tay-Sachs disease, and Tay-Sachs disease is nothing but the hexoaminidase A. So this hexosaminidase. So there's hexosaminidase A, and this hexosaminidase A, that's a Tay-Sachs disease, it contributes to the lactosyl ceramide. So there's presence of lactosyl ceramide. So on the other hand, let's look at what leads to the lactosyl ceramide. So on one hand, we had the ganglioside. On the other hand, we have the presence of the globocytes. So these globocytes and gangliosides, they lead to the lactoceramide. That's the step we are looking at. So this globocytes, it leads to the Sandoz disease. So this presence of the Sandoz disease. So the Sandoz disease is nothing but the hexoaminidase A and B. So there is hexosaminidase A and B. So the hexosaminidase A and B. So the Sandoz disease, it leads to the trihexosyl ceramide. So this presence of trihexosyl ceramide. So there's globocyte, there's Sandoz disease, and this leads to the trihexosyl ceramide. Next, there is also presence of the Fabry's disease. There is presence of the Fabry's disease. This is nothing but the alpha galactosidase. So this is presence of the alpha galactosidase. So this leads to ultimately the lactosyl ceramide. The lactosyl ceramide. So now this ganglioside, on the other hand, there is a Tay-Sachs disease we discussed, and this leads to the lactosyl ceramide. So this Tay-Sachs disease, the involvement is a hexosaminidase A. Hexosaminidase A. So this all leads to the lactosyl ceramide. Lactosyl ceramide. So now let's move ahead. So we stopped at the lactosyl ceramide, that is LC. So this lactosyl ceramide, what is happening is this leads to the cerebrocyte. So this leads to the presence of the cerebrocyte, and this cerebrocyte, it leads to the formation of the Krebs disease. The Krebs disease. So what is the presence of the Krebs disease? It is nothing but the beta galactosidase. So there is a beta galactosidase. That comes the presence of the Gaucher's disease. So in terms of the Gaucher's disease, here it is the beta glucosidase. It is a beta glucosidase. So first is the Krebs disease, then comes the Gaucher's disease. So it is Kg, and K for the Krebs disease stands for the galactosidase, and G for the Gaucher's disease stands for the glucosidase. So here the Gaucher's disease, so we left out with the Gaucher's disease. So here the Gaucher's disease, this leads to the presence of the ceramide. So this is nothing but the ceramide, and then the ceramide, it leads to the Farber's disease. It leads to the Farber's disease, that is the ceramidase. And then this further leads to the sphingosine. It leads to the sphingosine. So here, let's look at some of the alternative steps which join the process. So there is the sulfatides. So there is presence of the sulfatides. So this sulfatides, it acts on it leads to the cerebrocytes. So this leads to the cerebrocytes. So the sulfatides, the presence is the metachromatic leukodystrophy. So here there is involvement of the metachromatic leukodystrophy. So it's presence of the metachromatic leukodystrophy. So what is the process here? So it is involvement of the aryl sulfatase. This is aryl sulfatase, and it is A, aryl sulfatase A. And then in case of there is also the sphingomyelin. So in terms of the sphingomyelin, there is it goes to the ceramides. So we saw the step with the cerebrosides. It gives rise to Krabbe's disease and the Gaucher's disease, and then comes the ceramide. So here the sphingomyelin joins, and in between there is a Niemann-Pick's disease, NP disease. So Niemann-Pick's disease is the sphingomyelinase, the involvement of the sphingomyelinase. Now let's look at the disorders in detail. So first we will look at the Tay-Sachs disease. The Tay-Sachs disease, the enzyme defect here is going to be the hexosaminidase. There is the hexosaminidase. So it is nothing but the hexosaminidase A is the enzyme. And what is the lipid accumulating? The lipid which accumulates is nothing but the ganglioside. It is a ganglioside. Then comes the presence of the clinical symptoms. The clinical symptoms of the Tay-Sachs. The Tay-Sachs disease, the symptoms is going to be the MR. MR stands for the mental retardation. Then comes the blindness, as well as there's presence of the muscular weakness, which can also occur. Then we look at the Sandow's disease. So in terms of the Sandow's disease, there is the enzyme defect of the hexosaminidase. So there is presence of the hexosaminidase. There's presence of hexosaminidase. This is going to be A and B. The hexosaminidase A and B. So what is the lipid accumulating? The LA, that is the lipid accumulating, it is nothing but the globoside. It is the globoside as well as the ganglioside. Next, let's look at the clinical features or the clinical symptoms of the Sandow's disease. The clinical symptoms, it is similar to that of the Tay-Sachs, as well as they have presence of the hepatosplenomegaly. So this H is the hepatosplenomegaly as well as the skeletal. There is a skeletal dysplasias. This presence of the skeletal dysplasias. Next, we move on to the Fabry's disease. So there is presence of the Fabry's disease. So this Fabry's disease, there is an enzyme defect. The enzyme defect here is nothing but the alpha galactosidase. So there is presence of the alpha galactosidase, and the lipid accumulating in terms of the Fabry's disease is the Fab. Okay, it is the globotriacyl ceramide. So it is a globotriacyl ceramide. So this is going to be the lipid accumulating. So now let's look at the CS. CS stands for the clinical symptoms or the features. So here there is the skin rash. So this rash, and there's KF, that's a kidney failure. So there are full symptoms, they occur in the males. So symptoms, they occur in the males, and this is X-linked recessive. So now we looked at the Fabry's disease. Fabry's disease is nothing but the alpha galactosidase, and there is involvement of the globotriacyl ceramide. Next, we are moving at the metachromatic leukodystrophy. So it is a metachromatic. So we look at the metachromatic leukodystrophy. So in terms of the metachromatic leukodystrophy, the enzyme involved here. So there is meta, right? Meta. So it ends with A. So here the metachromatic, it is nothing but the aryl sulfatase A. So aryl sulfatase A. So aryl sulfatase A, what is the lipid acting here? The lipid accumulating here is a 3. sulfo-galactosyl ceramide. 3-sulfo-galactosyl. 3-sulfo-galactosyl ceramide. This is the lipid which is accumulating. Now let's look at the clinical features of this disorder. The clinical features of the metachromatic leukodystrophy. So in terms of the metachromatic leukodystrophy, there is the involvement of the MR. MR stands for there is presence of the mental retardation, as well as there is psychological disturbance which takes place, and this psychological disturbance is nothing but in terms of the adults, as well as there is demyelination. There is presence of the demyelination. Next, we look at the Krebs disease. So what happens in terms of the Krebs disease? So there is a Krebs disease. So this Krebs disease is nothing but the involvement of the beta galactosidase. So there is beta galactosidase, and this was about the Krebs disease, the enzyme involved. So the Krebs disease is the beta galactosidase, and the enzyme involved here is nothing but the glucosyl ceramide. So the enzyme involved here is the lipid which is accumulated is a glucosyl ceramide. So ceramide, the glucosyl ceramide is involved with the Krebs disease. So what happens in the Krebs disease? So in terms of the Krebs disease, there is an enlarged liver. So the liver is enlarged, the spleen is enlarged, as well as the liver is enlarged, the spleen is enlarged. Then comes there is erosion. The erosion takes place, and this is nothing but of the long bones. So the erosion takes place of the long bones. Next, there is also the mental retardation. The mental retardation here is nothing but of the infants. Then we move on to the NP disease. So what is meant by the NP disease? NP disease is nothing but the Niemann-Pick disease. The Niemann-Pick disease, the enzyme defect is of the sphingomyelinase. There is sphingomyelinase. Sphingomyelinase is nothing but the defect here. And then we look at the lipid which is accumulating. The lipid accumulating is a sphingomyelin. So it's very easy. The enzyme is a sphingomyelinase, and the lipid which is accumulating is a sphingomyelin. So what are the effects here? The clinical symptoms or the clinical features is nothing but there is an enlarged liver, as well as there is presence of the enlarged spleen, and there is also presence of the MR, stands for the mental retardation, as well as it is fatal in terms of the early life. Next is the presence of the Farber's disease. So the Farber's disease, the enzyme involved is a ceramide. So easy to remember, it is F and C, FC. So the enzyme involved here is ceramide and ceramidase. So let's write it clearly. It is ceramidase. Now what is the lipid accumulated in terms of the Fabry's disease? So in terms of the Fabry's disease, the lipid which is accumulated, this is nothing but the presence of the ceramide. It is the ceramide which is accumulated. So what is the clinical features here? The clinical symptoms or the clinical features is going to be there is presence of hoarseness. So there is presence of the hoarseness, as well as there is dermatitis. There is presence of the dermatitis. Next comes the skeletal. There is skeletal deformation. Then comes the MR, that is also the presence of the mental retardation, as well as it can be fatal in the early life. It is fatal, and this will be in the presence of the early life.